Next, we welcome an esteemed figure from India, a pioneer in cardiac surgery with over 26 years of excellence and more than 15,000 surgeries to his name, Dr. B. Durgaprasad Reddy. From groundbreaking procedures to innovations in congenital heart surgery to heart-lung transplants, his clinical mastery is matched by groundbreaking innovations like the globally recognized single-patch closure for AV canal defects. Please join me in welcoming Dr. Reddy.
Good evening, everyone. So, the previous speaker was excellent, and he was speaking about cardiac arrest and cardiac disease. So, in this era, we've forgotten about congenital heart disease, because they have also a lot of issues. We have 8 and 12 live births. For 1,000 births, we have 12 childs born with a congenital heart defect. So, let's not take it lightly. Congenital heart disease, this topic is about emergency cardiac surgery prevention. But I'm going to talk about something, how you prevent this congenital cardiac diseases in children. So initially, we all say smoking, alcohol, very bad. I'm sorry to say this, but this is how it is. You start smoking. What happens to the child, especially a pregnant woman, you start smoking, the child becomes intrauterine growth retardation, a lot of congenital heart defects. It's mandatory to avoid smoking. And alcohol. There's something called as fetal alcohol syndrome. You got to be very careful about this. A pregnant woman, especially in the 3rd trimester, she starts taking alcohol. You get something called as a fetal heart syndrome. What is this? There's something called as atrial septal defects, ventricular septal defects, and tetralogy of Fallot. These are the combinations you get in fetal alcohol syndrome. So be careful, pregnant women, any women, you want to have a safe, good, live, healthy child. Avoid alcohol and smoking, most important. And don't take unnecessary drugs in antenatal period. This is like aspirin. You start taking aspirin, what happens? The main circulation which is happening in the fetus gets blocked. When the child is born, you'll be born with a very high lung pressure. So you need to avoid aspirin during pregnancy. And certain things like drugs like steroids, diabetes. Always remember, congenital heart mother will always give rise to a child who is having 15% chances of getting into a congenital heart disease. So, how do we prevent this? Especially a child is brought, 2 conditions. What we say is left-right shunt, and little technical. If you can have me questions, I can answer that. Little bit of technicality I'm speaking. So there are 2 conditions where the child will have a left-right shunt and a right-left shunt. Left-right shunt is more of breathlessness going into cardiac failure. Right-left is more of becoming blue and not giving blood supply to the lungs and getting arrested, respiratory arrest they'll have. So when a child comes to you, first you have to differentiate whether the child is because the child is blue. You have to differentiate whether why the child is becoming blue. It can be 2 causes, one the respiratory cause or a cardiac cause. So how do we differentiate it's a respiratory or a cardiac cause? If the child cries, the saturation improves, it is a respiratory cause. If the child cries, the saturation drops further down, it has to be a cardiac. So be aware. So whenever you see a child who is blue, try to comfort the child and try to put the child's both the knee chest position, what do we call, get the knee onto the chest. So what happens when the child is too blue? While putting this knee onto the chest, you kink the femoral artery and the femoral vein. By doing that, you will increase your systemic vascular resistance and decrease the systemic venous return. By doing that, all the blood is getting pumped into the lung. So this is a common maneuver every man can do there. Whenever you see a child who is very blue, try to do this called as knee chest position so that you push the blood more into the lungs. Okay, so this is what we see most of the things, and always also find from a child if he's got a lot of forehead sweats. If the child has got a lot of forehead sweats, it has to be a low cardiac output syndrome. Comfort the child, give a lot of diuretics, and get the child from the situation. Okay, so What we see in India, back India, is the most commonest is tetralogy of Fallot. I don't know in England what we see, but most commonest congenital heart disease is tetralogy, where we get something called as a cyanotic spells. How do we get cyanotic spells? When the child is irritable, your systemic vascular resistance goes down, more blood pulling into the limb, and there's not much blood going into the lungs. For this to prevent, you need to do something called as knee chest maneuver. Okay, and the other conditions are surgery only. Most of the child who come with emergency situations to the operating theater, you have to operate. How do we operate? We do some systemic shunts, or straight away we have some calculations. So straight away we go ahead with something called as intracardiac repair or arterial switch. If the surgery is not possible, then what we do is we just puncture the septum so that the cardiac output is maintained for that moment. Otherwise, initially, we try to do some maneuver. We have something called as Magoon's ratio. We calculate the diameters of the pulmonary artery and the aorta at the diaphragm, and then we plan the surgery. So this is what is pediatric cardiac medicine. So be aware that we should always look into children's getting into congenital heart disease. So try to avoid this. No smoking, no alcohol, most important thing. No drugs like aspirin during pregnancy. So I end my speech by saying this: you need to be careful in congenital heart disease, because we can save a child by doing 70%. You can prevent chromosomal abnormalities. You can't do anything, but at least by preventing these things. And one more important thing is consanguineous marriage. Even they get a lot of congenital heart disease. So end my talk. Thank you for listening, and please be aware of what I said. Thank you.